Well, ladies and gentlemen, welcome to this summit in Gstad. I'm very happy to welcome you to this session. My role will be to make a presentation on the project Gstad Clinic. I'm Olivier Girardin. I'm the CEO of H Partner, a small consulting company based in Switzerland and active in the domain of healthcare. The objectives of this presentation are threefold. First of all, to briefly present the concept of an acute care clinic in Gstad, discuss the major trends in the healthcare sector and the opportunities that arise from them, and provide some information on three dimensions that will characterize the philosophy of this Gstad clinic, namely the smarter medicine movement, patient engagement, and also precision medicine. So this is, in fact, the frame of the presentation. There are, as you know, big trends that will characterize the evolution of healthcare, and this not only in Switzerland, but all over the world. Everywhere, the current trend is towards the closure of clinics and hospitals in favor of the development of larger structures. For instance, in Switzerland, we used to have 50, 60, 80 bed hospitals. This is gone, and we move towards larger structures. We also see acute care hospitals that are increasingly working in networks and in ambulatory mode. Before, we used to have many beds. This has reduced, and new treatments are offered on a day basis. Even, for instance, for an orthopedic surgery, we can reduce drastically the average length of stay of the patient. At the same time, the development of telemedicine, artificial intelligence, and networking, including computerized medical records, care protocols, makes it possible to provide high-quality local services, which means that you don't have to go to world-class centers in the United States or in Paris or London to get the best treatment, because the protocols, telemedicine, offer the possibility to be treated where you are. It is in this context that the Gstad Clinic will be created. There are major trends that transform healthcare, as we have just seen. But I would like to specify that there are three tsunamis that would really change the way we practice healthcare. The first one is an increase and aging of the population. Not so difficult to understand that this will have major implication, one being an increase in chronic disease. In other words, we have less acute care in hospitals and more chronic disease. This is a major trend. A second one is the patient. It's you and me. We want to be better informed. We want to be involved in the treatments. We call that patient engagement. This is a major change, which means that the doctors, the nurses, and all the people implied in healthcare have to change their minds. Another important element is the growing importance of precision medicine. We will see that in a few minutes, what we have to understand under this term. Another element, what we observe in healthcare, for instance, in Switzerland, is that we observe lots of fragmentation and variation in the treatment proposed. And one element to change that will be to align the incentives. In other words, as long as not all the players in healthcare feel responsible, then each one will in fact practice and treat the patient from his point of view, not coordinating, not exchanging, not adopting common protocols. It's quite common in Switzerland that we do 2 or 3 times the same CT or MRI exams, which of course translates in additional costs that are not useful. So this is the general context. This being said, we see that there is an opportunity in Gstaad to develop an acute care clinic with some specifics. The concept has still to be refined. What we are working on currently is the following. You know that, or you may know that the clinic has been founded by Mr. Stephen Lowe in last April. The idea is to create a clinic that will open on a 24-hour, 7 days, 365 basis. The clients will not only be the local population, but of course also the HNWI clients, the jet setter coming to Gstaad. The clinic will encourage top medical experts and their support staff to come and work in Gstaad. One element of the concept is that the clinic will have the most advanced low-dose radiation CT scan and the latest 3 Tesla MRI, among other equipment. And one question, of course, at this stage would be, why would doctors and the support staff decide to come and work in Gstaad? For different reasons, but one is certainly is that it's a unique place situated in the southwestern part of Switzerland in the Bernese Alps, an absolutely magnificent place. And we know that many people are looking for this type of environment. The future clinic will be comprised of 3 pillars. The first one will be what we call today a walk-in clinic, which means that you can have a medical appointment without having made a reservation. Also for emergencies, then a diagnostic center based on a very performing radiology institute, a lab, genetic, and then a care center with primary care, specialized medicine, and the focus will be put on rehabilitation, better aging, and prevention. Other services may be added. This is perhaps too early now to mention, but the concept is underway, and we will be glad to inform you as we move forward. What is the vision of this Gstaad clinic? The vision is that by 2026, the Gstaad clinic aims to be a leading clinic in the Alps in terms of quality and added value for patients, but also for doctors. This will be achieved with a first-class medical team, therapists and caregivers. And of course, this will be reinforced with alliances with top institutions and doctors with a high reputation. I mentioned at the beginning of my presentation that there are 3 dimensions that will influence the concept under development. The first one is what we call today smarter medicine. Smarter medicine is in fact a movement inspired by the American Choosing Wisely initiative, which recommends abandoning investigation and treatment that have no added value for patients and whose risk could outweigh the benefits. And there are numerous, as we will see in a second. We have an association in Switzerland, to date 15, and each association, in fact, defines the 5 most often superfluous medical measures, scientifically supported and published by the medical societies. So if we look practically, we see that, for instance, there are recommendations that are strongly supported, such as no radiology for non-specific back pain until 6 weeks, no antibiotic for upper respiration tract infections without signs of severity, or for prescription for proton pump inhibitors for long-term gastrointestinal symptoms. So these are some recommendations that we can find today published by the medical societies. We believe that the Gstaad clinic should bring this dynamic in the Gstaad-Sannenland region by involving its doctor and the doctors in a network that will construct a coherent and quality medical projects. So this is the first element that will have an influence. The second one is patient engagement. This is something new, even though in hospitals or systems in the States like Dartmouth, Intermountain, it has been there for quite some time. It's patient engagement. Patient engagement is, as we say, a broader concept that combines patient involvement with intervention designed to increase the motivation and promote positive patient behavior. This is indeed one of the problems we have in medicine today, is the proper compliance of patients, especially those suffering from chronic disease. Patient engagement is a key element in improving compliance with prescribed treatment. It's also part of a strong trend where patients want to be part of the selection of their treatments. So this is a clear element. The third dimension that will have definitively a big influence on the portfolio of services provided by the Acute Clinic is precision medicine. This concept goes back to the 2010, where precision medicine has been strongly supported by the US government, and the idea behind it is tailored therapy at the right time. The idea behind precision medicine is to provide personalized diagnostic so that you can treat illnesses individually, personalized prevention, recognize the risk we are all running, and finally, personalized development in order to improve the quality of life. More specifically, precision medicine is a new medical discipline that uses patient-specific biological, environmental, or social data to better understand the probability of developing diseases. With your DNA profile, we can evaluate your risk to develop an Alzheimer or a Parkinson's disease, for instance, certain types of cancer. And the aim is to propose targeted preventive measures, refined diagnosis, and personalized treatments. Indeed, each of our cells contains a very long sequence, 3 billion characters, of the genetic code that allow us to build our individuality, the DNA. It's a very complex plan inherited from our parents. The knowledge of the DNA of an individual represents the founding element of precision medicine. And obviously in Gstaad, we want to be in the lead with this approach. The advances happen daily, and this is why not only a treatment will be provided, but our teams will also be involved in research at, of course, a modest level, because Gstaad is not a hospital with 1,000 doctors, but still we can do great participation in this approach. This is what I wanted to say, ladies and gentlemen, on this Gstaad project. I am sure you will be very keen on knowing more, and we will keep you informed as the project moves. I wish you an excellent day, an excellent summit, and be glad to be back later. Goodbye for now, and have a nice day. Bye-bye.